the Beverly Hills Plastic Surgery Podcast. I'm Dr. Rovello, and I am here today with Dr. J. Calvert. How are you?
I am really, really good.
Really good.
You know why I'm really good?
Why are you really
Because
good?
yesterday I did 14 hours of surgery in one day.
That's a lot.
On purpose. and today I did 0.
That's a nice little
I needed the 0 today.
trade.
I was like, I'm not doing much on Wednesday. We could have put one of these huge cases on Wednesday, but no, let's do them all in one day.
That sounds like a Dr. Rovello day.
It is. Oh, I know. When I'm like trying to reach you on Monday and it's like 7 p.m., I was like, she's probably starting her third case right about now.
Right about now.
I got one more after this too.
Yeah, that bilateral recon starting, right about now.
Didn't you have one yesterday though? It was like 5 p.m.?
Yeah, I did. Cases have to go.
I think
they gotta
when
go.
you gotta go, you gotta go.
You gotta go.
That's for sure.
So when you do a lot of surgery, lots of hours, lots of cases, there is no way around the fact that you are going to have complications.
If you're operating, you're having complications.
And when we go through general surgery training, plastic surgery residency, we have weekly or monthly conferences that we call M&Ms. They are morbidity and mortality conferences where we go through all of the complications, all of the potential deaths that happen that week or that month. And we break them down into what happened, why they happened, and potentially how we can prevent that from happening. So it is ingrained in us as surgeons to be held accountable and to recognize when we have problems so that hopefully in the future we don't. That being said, it is inherent in surgery that you will have complications. And in fact, we would have attendings that would tell us as residents, if you don't have a complication, you are not operating enough. So it just goes without saying that it's going to happen. Now, if you are the patient and it happens to you, it's a much bigger deal because now it's happened to you. And I get that that is incredibly traumatizing. So this podcast is really about what do we do when a complication happens?
And it does happen. And, luckily we only have morbidity conferences in plastic surgery because mortality is like not part of the thing. Yep. But I will tell a story about that from a foreign country that will get people to go, maybe I'll stay in the United States for surgery.
That is
maybe I will.
Yeah. True. We don't have mortality, but every once in a while, random freak things do happen.
They do. And I've been in Beverly Hills now for since 1887, and the truth is that the deaths that happen in plastic surgery are so rare and so extraordinary, and there's always some crazy ass problem that goes along with that death. I can tell you that.
Right.
Most common, cocaine use.
I was just about to say drug use.
It's cocaine, and I didn't tell my doctor, and I'm 62 years old, and I'm having a facelift, and boom. Now you're dead. So cocaine and plastic surgery, not a good combination.
Not a good thing. Cocaine in anyone over the age of 40, probably not a good thing. The heart just can't take it.
I think the cocaine ever is never good. I don't know if anybody knows it's illegal, by the way. So whatever you think. I did have a patient say that to me, though. I was like, man, your nose had so much scarring in it. What's the deal with that? And he was like, the 80s. I was like,
got it.
Got it. Okay. Anyway, the reality is that complications do happen. Hematomas, seromas, wound problems, infections, scarring that's unfavorable, implant malpositions in breast surgery. These things happen. Problems happen, and they are not they're not negligent. They're not malpractice. Mm-hmm. There are problems that occur in the absence of negligence, in the absence of any malpractice that are, and this is something that always comes up. Like, all patients come in and say, like, I'm having a hard time breathing through my nose. I should sue that guy. I'm like, breathing difficulties after a rhinoplasty are a risk of surgery, and we are not able to consent for malpractice. You can't have a consent where you're consenting somebody to a problem that can occur. It's not malpractice. It is simply a sequela and a problem that can occur after surgery.
Like we said, happens infrequently, but it does happen. And when it happens to you, it's 100% of the time, and it's miserable. So what do you do? And we're not going to go through every single complication that could possibly happen because there are so many that are potential, and there are so many that are common, and then there are the ones that happen randomly that you could never have predicted. And so a lot of times there's just no telling. But when it happens, there are a couple things and a couple steps that you have to go through. The first thing, I think the most important thing in the beginning, stay in contact with your doctor. Go to your follow-ups.
100%.
If something seems strange, abnormal, call the office, call the doctor. Because please, 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 the earlier we can catch these things, a lot of times the better we can treat them.
100%. And you have to speak up. If it doesn't seem right, give us a shout.
Yes.
And don't think like, oh, I don't want to upset them. Like, we're here to we know about complications. We've consented you for surgeries that have inherent risks involved in them, and we are prepared to take care of them so that you can still get a great outcome.
Absolutely. And this is why I have my patients coming back week after week after week. And they're going, well, I live far away and I'm coming from a couple hours. I don't care. That sounds really mean, but I need you here because I am concerned about complications. And I need to know that you are doing okay. So I need you to get your 2 hours on the road and come see me because it is important. Like, I want to see you because I want to make sure that everything's going okay. And it's important.
It didn't sound mean at all. But it is like, you have to do this.
Yeah.
And it is again, go back to our, podcast about like post-op instructions. Like you have to follow the instructions, and part of it's following up because things do occur that we can identify early and head it off at the pass so that it doesn't become a problem.
Yeah.
But let's say you do a breast augmentation and it's, 2 weeks after and you're vacuuming your house and the breast starts to blow up like a balloon, which has happened, and you're getting a hematoma. You need to call. Don't panic. Do call right away to say, hey, there's something going on. My breast looks like it's twice the size of the other breast. This does happen.
Yep, sure does.
Especially during vacuuming. I find that early vacuuming is a common reason for
mine is
hematomas.
Light housework.
Light housework.
What are we doing? Just some light housework, some light cleaning.
I think that falls under vacuuming too. It's in there. It's all the same thing.
I know.
Rearranging the furniture has caused a hematoma as well. That in the first post-op week. So try to get this stuff done. Get out of your own way. Don't do it before. Do all that stuff before surgery, and then recover for 3 weeks so that you don't get a hematoma. But should you get one, call us.
Call us.
We will be taking you to the OR to drain that hematoma.
Right, pretty quickly. Now, there are very few things that are true emergencies in plastic surgery. Usually we have a little leeway of time, a couple days, to get you to the OR to address things.
For sure.
So outside of the immediate 24-hour time period where there might be some emergency bleeding, anything that happens after 24-hour window is very rarely an emergency, but still something that should be addressed sooner. So there are some things that do require trips back to the operating room. A hematoma would be one of them. Possible wound dehiscence. I've heard of some patients that had an immediate implant malposition that was noted almost right away. That's an immediate return to the OR. So there are some things that have to happen right away. And then there are some things that we watch. So maybe there's a wound care issue or a mild infection that we're going to treat with some antibiotics. And we're going to follow you on a regular basis. And if it doesn't get better, then maybe we have to go back to the operating room. So these are all things that are possibilities. And I don't want to say worst case scenario is you have to go to the operating room, but that's usually the last step in terms of what we have to do to fix a complication.
Yeah, problems that occur from surgery tend to need surgery to fix them. I mean, it's just, it makes sense, right? You have problems that were induced by incisions and moving tissue or putting in implants, and now you have a seroma. Like these things need to be handled. It's not a big deal, except it costs money.
Except that it costs money, and that is usually where the most anxiety comes in for patients, because a lot of times these were cases or procedures that were done for cosmetic reasons, and a lot of insurance companies throw up their hands and say, well, that's not an insurance procedure.
You picked it.
We're not paying for it. So now who's on the hook? And it definitely becomes an issue. So in my practice, the way I typically address it is all of my patients get CosmetiSure. That's an insurance specifically for cosmetic procedures. And it's not an option. You can't opt out of it. If you are having a cosmetic surgery, you sign up for that. And then should a complication occur, say you have to go to the ER because we're concerned about a blood clot, or say you do have to get IV antibiotics for an infection, the way it works is your insurance gets billed by any entity that worked on you. If they pay it, fantastic. If